Hello, my name's Kim and I'm part of the community diabetes team. I'm sure we've all heard that being more physically active can improve our health, but when we're managing one or maybe even several long-term health conditions, exercise can feel like a huge challenge. If you are inactive, setting unrealistic targets like exercising for 30 minutes a day or walking 10,000 steps can immediately seem like an impossible goal. The good news is that it's okay to start small. And in fact, people who are building up their physical activity can start to see some really significant benefits quite quickly if it's done regularly. So what do we mean by physical activity? Well, any kind of movement will be beneficial. Many of us sit for 10 hours per day or more, and just sitting for long periods can be bad for our health. Sitting impacts our skeleton, our muscles, can slow the breakdown of fats in the body and how we absorb glucose. Even generally active people can benefit from taking a break from sitting. So if you can, get up and move around for a few minutes every hour. Aerobic exercise helps our heart and blood flow around the body. Ideally, we will do something every day to raise our heart rate and increase our breathing just a little. The important thing here is to do something that you enjoy, like walking, dancing, swimming or cycling. If you can do something you enjoy, it's more likely that you'll stick with it. It's also important to be safe, so you may want to consult a medical professional or a physio, but essentially we encourage people to do just a little bit more than they're doing at the moment, and to build on that, going just a little bit further or getting out a little bit more regularly. It can be helpful to try and build habits around your own routines. So for people with diabetes, moving after a meal is a useful way to improve our blood glucose management. So try and build in a short walk after each meal. Finding a friend, colleague or family member who also wants to move a bit more is helpful to keep you going if your motivation wanes. You may have heard that we should all be doing some resistance or strength exercises each week. This is not just about going to the gym to do weights. Carrying shopping bags, gardening or doing chair-based exercises with cans from the store cupboard can all help to strengthen muscles, which mean our heart doesn't have to work quite so hard when we move. There are some great suggestions on the Diabetes UK, British Heart Foundation and NHS websites if you're looking for inspiration. And if you're trying to lose weight or on a GLP-1 medication or a postmenopausal woman, you may benefit from this type of activity to protect your muscle mass and bone density. Finally, balance and flexibility can reduce our risk of injury and falls, helping us to maintain independence and to stay active for longer. So stretch those muscles and see how long you can stand on one leg before you have to grab onto the countertop for support. So in summary, activity is really helpful with managing your diabetes, to reduce the risk of complications and to get the most out of your medication. We also know that it can contribute to good mental well-being as well. The key to increasing your physical activity is really to do something. Start small, build it into regular daily activity and to make it fun. So instead of watching from the sidelines, start moving and see where it takes you today.